It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it is great to have you in studio with us today. We're sitting down on the phone with Yavapai County Community Health Services Director Leslie Horton. Website for you, yavapai.us/CHS. Phone number 928-442-5103. If you have questions about COVID-19, that's the Yavapai County line. You can call Monday through Friday, 8 to 5, and get answers to your questions. Hello, Leslie. Welcome back.
Thanks for having me, Paul.
So, here we are. How many weeks are we into this right now?
I think we're about 5 or 6 weeks into this. You know, we got our first cases around March 18th to the 20th, so here we are just over a month into seeing new cases of COVID-19.
It's been unbelievable. I don't think anyone can argue that. It's been extremely unbelievable what has happened across the world. Let me ask you this. What is our current status right now in terms of COVID-19 in Yavapai County?
Yeah, I'm happy to answer that. And Yavapai County is doing rather well in terms of COVID-19 and controlling the spread. So far, over about the last, I'd say, 11 days, we've had only about 0 to 1 to 2 cases trickle in each day, which has shown that all the mitigation measures that we're employing right now are really working. And right now we have 74 cases in Yavapai County. We've tested about 2,077 residents, and in calling people to find out how they're doing about 2 to 4 weeks after they tested positive, we also have 6 people who have fully recovered from COVID-19.
Not everybody's in the hospital that gets diagnosed positive for COVID-19.
No, not at all. And actually, we're seeing only about a 4% positive test rate. So of all of those people, the 2,077 residents who have tested, only 73, let me re-speak that. Of the 2,077 residents who have tested, only 74 have tested positive as of today. And so that's about a 4% return rate on our test.
Wow. My wife was pretty heartbroken a few weeks ago because she was seeing the faces of people when they're told you have COVID-19. It's got to be a difficult thing to tell somebody.
Yeah, it's a tough one to take, and many people who have COVID-19, they don't even see symptoms. Some see minor symptoms of a respiratory cold or possibly a fever. But then there are those people who fall into a high-risk category or who have underlying health conditions who can get very ill from this. And there are people who really suffer from COVID-19. And so it's not an easy diagnosis to understand or to know how that's going to pan out for you.
Now, hospitals are not overrun with COVID-19 cases in the state, are they?
There are hospitals who are seeing heavy influx of cases. Some are becoming overrun, especially up in northern Arizona. Flagstaff Medical and some of our hospitals serving Navajo County and Coconino County are seeing high rates of people in the hospitals. I just heard today that there's 40 people in Flagstaff Medical who are hospitalized with COVID-19. And yet, here in Yavapai County, it's a very different situation, and we have generally on average about 6 people a day between the Verde Valley Medical Center and YRMC. And so we're not seeing as many people here hospitalized, and I know that our hospitals actually have plenty of capacity to help if other counties get overrun.
There was a new line that the Arizona Department of Health Services launched yesterday called the Arizona Surge Line, which I thought was kind of interesting, where the state and the hospitals together all kind of keeping track of how many beds they have available, the ventilators that are available, and as the beds clear up, they have to announce, okay, we've got a vacancy here if we need to help somebody out. But I have understood that the Navajo Nation and Navajo County have quite a few cases, and they're kind of spilling over into the hospitals throughout the state.
They have. That surge line has been a great benefit in that the hospitals are tracking every day how many beds they have available, and those that are overrun can look to see anyone in their nearby area where there are beds available, they can send people to those for care and making sure that each hospital has the capacity to handle what's coming in.
Now, you've been gracious enough to talk to me every week, at least one day a week, to give us kind of an update on how things are going in Yavapai County with COVID-19, and here you are again today sitting down and doing this with me as well. The testing has been something I've asked you about, I think, just about every time you and I sit down and chat for a little bit. There at the beginning, it was taking up to a week to get test results back, or even longer than that, and then it was a couple of days. How are the test results coming back at the moment for the state of Arizona?
Right now, it's looking like most test results are returning in about 24 to 48 hours. And so that's been really a nice change from the beginning, whereas we were having to wait sometimes over a week for test results. And so in most cases, people can get their test results within a day or two. In some cases, recently we've seen up to 4 days wait time, but it's much improved from the beginning of this process. And we are hoping to see more providers in Yavapai County offering more rapid tests, which may be in getting results in less than an hour.
Do we know, is that something, okay, so there's a lab, say, in Yavapai County that could do the testing, but is there some kind of training you've got to go through before you could even be able to do a COVID-19 test and check it?
You know, there is a protocol for the testing, but it's a rather simple test that is run. You just have to have the proper mediums and testing protocols in place within the lab. And so that's what YRMC has been working on, getting their lab set up internally so that they can run tests in the lab here. Their difficulty is that they're running out of test kits on a regular basis and need to make sure that they have plenty of test kits if they're going to run those tests internally in their own lab.
We need a lot of tests, don't we? I mean, there's 7.2 million people in the state, and only a little over 55,000 or something have been tested so far?
Yeah, we do need more widespread testing to really get an idea of an accurate picture of how COVID-19 is affecting the state. Here locally, we've seen very few cases come through with COVID-19, which is a good sign. That just shows that of all the people who were high risk, who thought they had an exposure, the first responders getting tested, and anyone else who felt like they had symptoms of COVID-19, when they get tested, only about 4% of those are coming back positive. So with the testing we're doing, it's showing a pretty accurate picture, but there's still a lot of people who feel like they should be tested who have not been able to.
Now, for our first responders, and you, for that matter, I'm sure you've had a COVID-19 test to see if you're free and clear. You're the health department director for the county.
I actually have not been tested.
Oh, okay.
And the reason being is every day when I come into work here at the Emergency Operations Center, I get screened. And so they're looking at my temperature, if I've had any symptoms, if I've had any known exposures. And so far, so good for me. And I would prefer, if I'm not a high risk, that I allow those tests to be available for our first responders or those at high risk.
How often does somebody have to be tested? So if I get tested this week and I'm a first responder, say I'm a paramedic, if I get tested this week, am I going to get tested again next week and the week after that? Or how does that kind of play out?
You know, for the most part, our first responders are not being regularly tested at intervals like that. Right now, they're tested if they've had a known exposure. So let's say they came into contact with or transported someone who was COVID-19 positive or tested at the hospital and was found to be positive. We can go back then and test the first responders who came into contact with that person. Otherwise, we look for things like symptoms or other markers that might show us that that person needs testing. Right now, with the limit on test results, we just have to, or on testing kits, we have to make sure that we're conserving those for people who are truly needing them at the time.
Okay, let's take our first break. Yavapai County Community Health Services Director Leslie Horton is in studio with me today. Yavapai.us/CHS will take you right to the Yavapai County Health Department website. 1-928-442-5103 is the number you call Monday through Friday, 8 to 5. You've got questions about COVID-19. Stick around, Countywide back in just a couple minutes.
From inspiration to installation.
If you need help with your decorating plan, call the pros at the Picture Window. We are your #1 source for top quality blinds, shades, shutters, and flooring. We've been in business here for 41 years, and our delightful sales staff has decades of experience. We're the locally awarded Best of the Best in both Sedona and the Verde Valley.
Don't pass up a free estimate on your project. Call the picture window now.
Paul Stanley here with Stanley Steel Structures. We offer shade structures that provide style, value, and performance. Our Equinox louvered roof opens and closes to give you the ultimate patio experience. We also offer Alumawood shade covers that looks like wood but lasts like steel and never needs painting or maintenance. Visit us at StanleySteelStructures.com. Contact us today and be covered tomorrow. Stanley Steel Structures. Let us add some space to your place.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
Turning your real estate dreams and goals into reality, I'm Claudette Johnson with Berkshire Hathaway Home Services. For more than 7 years, I've helped both real estate buyers and sellers put me and my team's extensive knowledge of the Sedona and Verde Valley area to work for you. Come see a 4-bedroom, 2-bath home with a 2-car garage. 110 Sagebrush Way in the wonderful Cottonwood Ranch subdivision is recently remodeled and waiting for you. Call us today and turn your real estate goals into reality. Claudette Johnson at Berkshire Hathaway Home Services of Arizona.
Welcome back to Countywide. I'm with Yavapai County Community Health Services Director Leslie Horton. Yavapai.us/CHS is the website for information. The COVID-19 numbers are updated every day on the site. 1-928-442-5103 is the number you can call Monday through Friday between 8 and 5. If you've got questions about COVID-19, a human being will actually answer those questions for you. Leslie, let's talk about, so we talked about the test, and we're still at a day or two for the results of that. That is way better than it was back when this first began. The antibody test. There's a lot of us wondering about this antibody test because that's going to tell us who had it and who doesn't have it.
Yeah, the antibody test would be a great thing for our area because even though we're not seeing a high rate of positive cases at this point, there's a lot of people who have this idea or have a feeling that they may have had this before we were testing for it. So back in January, February, and early March, before we were doing testing, a lot of people came down with similar symptoms as we would be looking for in COVID-19. And what an antibody test will do is show if you have already experienced COVID-19 and your body has produced antibodies to fight it off later, or a level of immunity, hopefully, that would keep you from getting it in the future.
Now, the governor mentioned, I think it was last week or the week before, the weeks have just blurred together anymore right now, but that there was 250,000 of these antibody tests coming to Arizona for our first responders to get them through that first. Is that still the case? Do we have those yet?
We are waiting to hear when those are going to actually be approved by the FDA. U of A has made a partnership with the state of Arizona, and they're going to produce those 250,000 tests. And we hope to make those prioritized to first responders and healthcare providers throughout the state of Arizona. So we're keeping in touch with the governor's office and U of A to find out when those antibody tests will be rolled out, when they're FDA approved, and made sure that they are giving us correct results. There's parts of the world that are opening up again. There's parts of the country that is opening up again. We're roughly about a week away before the end of April is here, and that's kind of when the stay-at-home or the shelter-at-home or stay safe, stay connected, all that was going on. It was supposed to come to an end at the end of April, or at least be reassessed at the end of April, so we've got about a week to go. Where do you think we are with that right now? Yeah, the governor's order does expire April 30th, and a lot of people have the idea that everything is just going to reopen and on May 1st when the governor's order expires. However, we're waiting for the governor's word to say whether certain counties can start to reopen in a phased-in way. We kind of phased a lot of our activities out, and the businesses that had to shut their doors or change their business models, that was phased in in Yavapai County and across the state based on the governor's orders. And now, my expectation is that the governor is going to give us word here in the next few days to say, all right, this is what it's going to look like across the state, but it may vary county to county. And I would see probably that the governor is probably going to give us a phased-in approach that would be about every 2 weeks, making significant changes in reopening if we're ready for that.
Now, Yavapai County has fared really well. Like you said, it's been kind of this trickle effect the whole time. It's never been this, not like we've seen in Coconino County, and even Coconino County is faring better than, say, Navajo County. Navajo County, it just kind of exploded there. And I think we kind of expected Maricopa County to the Phoenix area and Pima County to have a higher number of cases, too, because of their being metro areas. But to open back up again is kind of nerve-wracking, because I'm just looking back at what we saw in New York, just in New York, and how inundated the hospitals were with the people, and 1,400 people going into the hospital a day, hundreds being declared dead every day, and then just that work of that talk every day of we've got no personal protective equipment gear, the PPE was gone. Is any of that come back? Do we have the PPE? If we did open the world back up again and everybody went back to business the way they were before, which I don't think is exactly how it's going to be relaunched, but are we gathering the resources that we're going to need in case there is what they call a second surge of COVID-19 cases? And now all of a sudden we have New York across the country, where it was just New York and a few other larger cities across the country that were running out of the PPE, and they had the huge death rates and the huge number of people coming into hospitals that are sick. If that happened countrywide, could we actually handle that?
Like you said, Yavapai County has fared rather well, and I've been very proud of how our mitigation efforts have been working, and all of our businesses and our agencies have been working together so hard to make sure that we're protecting our most vulnerable citizens and abiding by the rules for the most part that the governor has set. And yet across even our state and neighboring counties, it's a very different situation. Like you mentioned, we're seeing hospital surges, high hospitalization rates, a lot of people getting very sick from COVID-19. And so, it's here in Yavapai County, we are pretty well equipped now with PPE. We were able to access our strategic national stockpile allotments, and we've been distributing those out to first responder agencies, healthcare providers, congregate living and assisted living homes, nursing homes, and in doing a great job of equipping everyone for what could come our way. And thankfully, we have never seen a high surge of cases, and we hope that here in the coming weeks, especially as we consider, reopening strategies, we hope that we'll be able to maintain our case numbers, not see any major spikes. But if we did, our hospitals, our first responder agencies, and everyone else involved who would need to help out are pretty well equipped for a surge if we were to see one. And we are surely hoping that we do not.
How long does PPE actually last for? I mean, like the typical mask you see maybe a person wearing in a hospital, the cloth mask. How long is that good for?
Well, most of them are disposable, and you could maybe use them a time or two. Those surgical masks, you should really get rid of those pretty quickly after use. But some of our PPE, like N95 masks and some of the other things, can be sterilized and used again. And the CDC has come out with great guidance to reuse that PPE and extend the use of it. So some of those things can be sterilized up to 10 times and utilized over and over to the extent where it helps us extend that life of the PPE. And especially in times like now of shortage, it can go a lot further than just disposing of it the first time.
It's amazing how much we've learned in just the last couple of months with this happening.
Yeah, being late in the game with this pandemic and having a lot of other countries experience the pandemic before we did, it's given us a lot of information, and it's really created a need to come up with some creative solutions because, a lot of our PPE was sent to other areas of the world before we ever had any cases of COVID-19 here. And so it's probably been very beneficial in some ways just to bring out those creative ways of reusing making good use of our supplies that we have, and knowing that we need better supply chains and probably stockpiles next time around if we were to ever see another pandemic.
Yeah, I'd agree. All right, let's take our second break. Yavapai County Community Health Services Director Leslie Horton in studio today. Yavapai.us/CHS is the website. A phone number if you've got COVID-19 numbers and you want to talk to a human being on the other end of the phone, it's 928-442-5103. Countywide back in just a couple minutes.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle. Get Gettles.
Hi, this is Greg at Verde Solar Power. You know, Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
ORKIN has pest control down to a science.
When your business chooses ORKIN's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the ORKIN man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona ORKIN and get more than an exterminator. Get an expert.
Welcome back to Countywide. Yavapai County Community Health Services Director Leslie Horton with us today. Yavapai.us/CHS is the website for the County Health Department. 928-442-5103. You can call that number Monday through Friday between 8 and 5 if you've got questions about COVID-19. Leslie, the world is ready to get back out. The weather is warming up. It's nice out. We want to go back to restaurants. We want to go back to stores. We're tired of being in our houses. It's almost like we're willing right now to just say, pandemic or not, we should all just go back out there. If I get it, I get it. If I don't, I don't. I don't know how to really ask the question, and I don't know really what the answer is for something like that.
Yes, I can see that people are very eager to get back out. And as I drive through town, you know, on my way to meetings and other things, that I just noticed that the stores are starting to have a lot more people in the parking lots. And the weather does change our perspective and our want to be out and about. And all I can ask people is to hang in there right now. We're doing such a good job in keeping our case numbers low and keeping the spread from happening, that we're not quite to that place where we can just give the green light to, you know, be physically together and being, you know, out in public and in the restaurants yet. But we're just about there. So if you can hang in there, make sure that we're still continuing to use the physical distancing standards, the good hygiene practices, washing hands often, wearing masks when possible, you know, to keep the spread from starting up here. You know, we're just about there, and I really look forward to the day when we can go back to whatever is the new normal after this. And I know a lot of businesses and a lot of our community members are chomping at the bit and ready to go, and we're just about there. And I just ask people to be patient, give us, you know, enough time to make sure that we are safe to proceed, and then we'll have some good guidance on how that looks in our community going forward.
I would hate to get this to this point where we are right now, where, like we've talked about, Yavapai County has had this sort of trickle effect, and then have it explode. And then we're all stuck another month as opposed to maybe another week or two, and to get past it, make sure we're past it, make sure we've got the tests we need and everything else is set up and in line, and then go out. And if we have an issue, we have an issue. But it seems to me if we wait just a little bit longer, we may not have that extra surge.
Yeah, that's absolutely right. And that is why we're waiting. It's, at the point where we're seeing 0 cases, that's a great thing. And yet we are still seeing some cases come in. We're doing very well. And yet it takes a little bit to make sure that other people aren't carrying COVID, and make sure that when we do give that green light that everything is free and open again. We want to make sure that we're ready for that and make sure that it doesn't create a surge in cases that we've been doing so well in avoiding up till now.
Well, Leslie, we thank you for everything you're doing.
Well, thank you for having me here, and I'll keep working hard just until this is in our past. And so I appreciate you helping me spread the word and get information out to the public.
You bet. Website again, everybody, yavapai.us/CHS. The phone number again, if you want to talk to somebody about anything you have on your mind about COVID-19, 928-442-5103. That is today's Countywide. As always, we thank you for listening, and we will talk to you again next time.